Shahid, sini. Good morning, Prof. My name is Mukesh Shahid and I'd like to be doing a trauma fracture assessment. So as an example, if the fracture is at the lower limb, first of all, before we start, we need to make sure that there is a proper exposure of the patient. As an example, I've exposed the lower limb of the patient and cover any private parts. Okay, first of all, we start with the inspection. Now when it comes to the limb, we have to look for any gross skin deformities, any open wound, any injuries, any lacerations, any avulsions, or any bleeding. Second of all, we need to look at the symmetry of the limb. Make sure that are the limbs, one of the limbs shorter than the other, and then look at the position of the limb itself. Whether one is shorter, whether one is externally rotated, one is internally rotated. After that, we move on to palpation. So for palpation, we have to start by sanitizing our hand. Start by sanitizing our hand. Ask the patient whether there are any pain. So let's say the pain is here at the tibia. So if the pain is at the tibia, we start distally from the pain itself. Okay. Now when we palpate the patient's, when we palpate the lower limb, we have to look at the patient's face, looking at any grimace or any expression of pain. So we have to elicit the tenderness. Start from the distal side, and then move towards the injured area, and then start from the proximal side. Move towards the injured area. Only after that, then we start to palpate the injured area. After that, if the patient has any wound or laceration, make sure that you are properly gloved. And then ask the patient the severity of the pain itself. Now to end the examination, we need to palpate the distal pulses. So in this case, we need to palpate. Number one is the dorsalis pedis, which can be palpated on the bony prominence of the dorsal side of the foot. And then also the posterior tibial. So where do we palpate? It's in the middle malleolus, posterior and inferior towards the middle malleolus. Okay. After that, we have to check the capillary refill. Let's say the patient is casted, so we can't check the dorsalis pedis and posterior tibial nerve. We can check the capillary refill time. Make sure that it is less than 2 seconds. Okay, moving on, I'd like to explain how to inspect for compartment syndrome. Now for compartment syndrome, there are 5 P's that we need to be aware of. Number 1 is pain, pulselessness, pallor, paresthesia, and also paralysis. Now to start with the examination, we need to do some passive stretching, in which we exert some force to stretch the patient's limb. Now in this case, let's say it is the ankle. So we start by doing ankle dorsal flexion to see whether there is any compartment syndrome on the anterior side, or we can do a posterior compartment stretching. Let's say it's on the upper limb. Same thing, we do flexion to see whether there are any pain upon passive stretching, and the pain has to be disproportionate to the amount, to the pain itself. Flexion, and then we can also stretch. So sorry, this is flex, this is extension of the elbow. So upon passive stretching, if there are any pain, then it might indicate compartment syndrome. Thank you.